Kylie Jenner came out with information and honesty about her own implant. Gosh, it's such nice and refreshing news that somebody is transparent. 445, moderate plus, halfway under the muscle. That means her implant is a 445 cc implant, which is on the larger size of implants. It is a moderate plus, which is the dimensions of it. Half under the muscle, well, people put implants under the pec muscle or above the pec muscle. Some people do cover the implant with pectoralis muscle and serratus muscle, so the whole implant's under the muscle. Her doctor, Dr. Garth Fisher, put it under the pec muscle, which literally only can cover about a third or half of the muscle. One issue that I have, and many of us have with under the pec muscle implant, is that the pec muscle will actually, when it contracts, will drive the implant down and to the side. So the natural contraction and use of your pectoralis muscle displaces the implant. The other thing that can be problematic about under the muscle is it can cause the implant to animate or wink. Women are getting out of a pool and they grab the ladder and their pecs flex. Well, then they have a little dent or an indent or a winking of their breast, which can be socially clumsy. So sure, I do put implants under the pec muscle, but more and more the last 2 or 3 years, most of mine are under the pectoralis fascia, but not under the muscle. They're not in contact with the breast, but they're under the pectoralis fascia, but they're above the muscle. Dr. Garth Fisher is a wonderful plastic surgeon. I met him years ago, and he taught me some of the techniques that I still use today for capsulorrhaphy or repositioning implants. Again, one of the problems with implants are they drift down, they drift to the side. Dr. Fisher taught me one of the techniques I still use. Capsulorrhaphy with permanent sutures like an inside bra to reposition the implant. Today, many of us are using resorbable mesh and these stitches to help keep the implants up in the first place so they don't drift down. So honestly, it's great to see a celebrity be honest and transparent. It's refreshing for me. It lets me have better conversations with patients. Personally, for me, I like them under the fascia, above the muscle, with some mesh that causes and forms an inside bra that helps hold them up.